Hi student, good afternoon. This is Professor Nugas. Today, I'm so excited to join you for another lesson today. So today we are going to teach you a question about pregnancy and postpartum. Okay? Before I do that, let me show you the book. So I have the physically the book today. So this is uh, real Nclex review questions. So those who have not bought the book yet, please go to Amazon, type real Nclex review question, and buy your book. Or you can type my name, which is Chanel, and then you will see the book coming up. Okay? So go buy your book. All the questions I am going to show you now are in the book. Please order the book. Okay? No problem. Let me say thank you for those who have already bought the book. We have more than 40 students who bought the book already. So, good job. Thank you very much. Okay? So, let's start now, class. So, we're going to start some question about pregnancy and uh, postpartum. Okay? What's going on about postpartum? Postpartum is very important class in the test, in the NCLEX test. Very important. You cannot pass your test without knowing the question about postpartum and pregnancy. Okay? Today, I am going to bring you some question about pregnancy and postpartum. All right? Let's start now. Let's start. Let's start. Okay. We have already in the book. The book. Those questions are. I am going to start on page 27. Page 27. That's what I'm going to start today. Okay? We're going to answer question on pregnancy and postpartum. Okay? We start on page 27. When you go to your book, open your book on page 27, and then you will get those questions. Let's start class. All right, the first question. What is recommended number of prenatal visits for a low-risk pregnancy? Okay, what is the recommended number of prenatal visits for a low-risk pregnancy? How many times the pregnant woman can visit the office? Okay, how many times? So according to the answer, you should know straightforward this answer. It's about 8 and 12 visits. Okay, 8 and 12 visits. Remember that, class. That's the first question. Second question is question 18. Which condition is routinely screened for during the first trimester of pregnancy? Okay, which condition is routinely screened for during the first trimester of pregnancy? So, the first trimester, you need to basically test for HIV. Okay, HIV. For example, we have the first answer is gestation, gestational diabetes. So that's not the answer. And preeclampsia, that's not the answer. And then we have the third one, HIV infection. So, which is the answer? Okay, which is the answer basically. All right. Question 19. What is the purpose of the glucose tolerance test during pregnancy? What is the purpose of the why we do the glucose tolerance test during the pregnancy? Okay, the first answer to assess kidney infection function. No, that's not this. To screen for gestational diabetes. That's not the answer. And then we have to measure blood pressure. So, so the answer is to screen for gestational diabetes. Basically, that is the answer. Okay, so we can say B is the answer to screen for gestational diabetes. All right, let's move on for question number 20. Which of the following is a common risk factor for preterm labor? preterm labor. Which of the following is a common risk? What risk we have commonly when the situation coming up? Which of the following is a common risk factor for preterm labor? And then high maternal age. No. Smoking during pregnancy. This is looking like the question. Smoking during pregnancy. D, single fetus pregnancy. You already see the answer, which is smoking during pregnancy. You cannot smoke. Okay? You cannot smoke. Okay? Do not smoke if you pregnant. The answer. Remember that. B is the answer. So, question number 21. Duration of exclusive breastfeeding according to the World Health Organization of exclusive breastfeeding. So 2 months, 4 months, we have 12 months. C is the answer, 6 months. You need to breastfeeding your baby during 6 months. Okay. Let's move on for question number 22. Which of the following is a common screening test for newborn? When your baby is delivering, what is the test they're gonna do for him or her? A. No. Second, B. Blood glucose test. Blood glucose test? No. Here, quick test. So that's exactly the test they're gonna do for your baby. Here, quick test. So MD, MI, no. C is the answer. Here, quick test. Make sure you take the note about that. Okay? So let's move on. C is the answer. Let's see question 23. Which vitamin is commonly supplemented in breastfeed infant to prevent deficiency? Okay, to keep your baby all right. So let's see what vitamin you should give him or her. Vitamin A. No. B. Vitamin C. No. C. Vitamin D. That is exactly the answer. Okay? D, vitamin D is the vitamin you should give your baby. Okay? Vitamin D. Which of the following is a sign of postpartum depression? A. The question on postpartum are very important. A. Extreme happiness. No. If you finish this, you happy, this is not a sign of depression. B. Lack of interest in the baby. All right. This look like the answer. Lack of interest in the baby. You don't care about your baby. You finish delivering your baby. You don't care. That means that is a sign of depression. C. Increase energy levels. D. Increase appetite. No. The answer baby. That is a sign of depression. Remember that. Therefore, B is the answer. Let's see question 25. When is the first postnatal visit? When the mother finished delivering the baby, what is the first visit? Week after? No. 2 weeks after? No. 4 to 6 weeks after? Exactly the answer. After 4 to 6 weeks, you need to see the doctor. You need to check. Okay? Therefore, C is the answer. Those questions are straightforward. They are very important. Okay? Number 20, position for an infant to sleep to reduce the risk of sudden infant death syndrome. What is the position place your baby? Okay, let's see. A, on the stomach. No. You know, long time ago, great mother, great father usually say, put your baby on the back. That exactly is. B, on the back. That is the answer. C, on the side. D, in a car seat. Come on, in the car seat. So B is the answer. Make sure you choose B. Okay, on the back. Place your baby on the back. Okay. Question 27. Let's go, student. Let's go. Which of the following is recommended for actor to skin? You should know what bonding means so that you can answer this question. Bonding means when the mother, the baby must touch the skin of the mother. Yeah, that's why when the mother delivering the baby, they have to put the baby on the mother's stomach so that the baby of the mother. Yeah, that's something like that. So let's see the answer. Delaying skin to skin contact. Delaying, no, 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 no. The baby need the skin contact, not delaying. B, immediate separation from the mother after birth. No, the baby must be related to the mother, touch the mother. C, early skin to skin contact. I believe this is the answer. Early skin to skin contact. D, bottle feeding immediately after birth. After birth. No. C is the answer. Early skin to skin contact. That means put the baby on the stomach of the mother. Okay? All right. C is the answer. Make sure you review those questions, student, before you go take your test. Okay? Those are important questions. Which postpartum condition required immediate medical attention? Question 28. Okay, if the mother finished delivering the baby, what condition, if you see the mother has, the mother need immediate attention? Let's see. A mild baby blues. No. Postpartum hemorrhage. Whoa. Postpartum hemorrhage mean, you know hemorrhage mean. Hemorrhage when you give blood away. That mean if you see this condition, call the doctor immediately. This mother need attention. That means B is the answer. Postpartum hemorrhage. C, normal fatigue. No. D, mild breast tenderness. No. B is the answer. Remember that, class? Remember, student? Number 29. What is the primary purpose of postpartum checkup? Why the mother need to be checked, okay, after the delivery of the baby? Why? A, to confirm pregnancy. No, it's already, the mother already gave the baby. B, to discuss birth control option. No, to assess the mother's recovery. Perfect. To assess the mother's recovery. Yes, they need to keep recovering the mother, keep assisting the mother, because the dangers after postpartum is common. Okay, C is the answer. Remember that. C is the answer. Question 30. What is the recommended time frame for initiating postpartum exercise after normal vaginal delivery? Basically, that is the last question, student. The last question. So they say, what is the recommended time frame for initiating postpartum exercise after normal vaginal delivery? If the mother gives the baby normally, how much time the mother must take before she returns to work? Immediately after birth? No, nobody, no mother can return to work immediately after work. No, that's not happening. 1 week postpartum? No, 1 week postpartum? No, 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 no. You cannot go back to work. Patsy, 2-3 week postpartum? No, you still not comfortable yet to go back to work. Basically, it's about 6 week postpartum. 6 weeks after the baby, you can go back to work. If you don't have any extension from a doctor, you should go back to work, basically. 6 weeks. Remember that, student. Remember. So that, student, thank you very much. I believe this is a very good lesson. on postpartum and pregnancy. So I believe you will see those questions on your test. You cannot pass your Nclex without knowing question on pregnancy and postpartum. Very important, student. All right. Student, remember to buy your book. And then today we work on page 27. And remember, you can go back and buy the book and review this question. And then go to Amazon and type real Nclex review question. Then you will see those questions, all those questions. Again, thank you very much, student who already bought the book. More than 40 students buy the book. This is a very good book, okay, guys? So thank you very much. Thank you very much, okay, guys? Thank you. God bless you. Thank you. This is Professor Nugas. Okay, thank you very much.